We talked a little bit, or you touched on prioritising children, and that must be very tricky, particularly with the kind of referrals that you're seeing. But you do have to put some priority on certain kids. How do you do that in the Wagga area?
We struggle. So we, as paediatricians, are responsible for triaging our own referrals. And in the public system, I think we probably get 20 or 30 a week, perhaps. And 19 of those 20 or 29 of those 30 would be regarding emotional issues or behavioural issues. And we don't have a good system. We try to prioritise kids that are starting school, but what about those ones that are already halfway through school and are struggling? Or we try to prioritise the younger ones, because as you alluded to, early intervention is just crucial. But then what about those 15 or 16-year-olds that are about to hit the adult service, and that leaves them with absolutely no one, that sort of grey area of 16 to 18. So we don't have a good way of triaging. It's a real struggle, and I think the GPs in our area have gotten onto this, and that's why nearly every first line of a referral will be something urgent. So this child has a cough, or this child is getting a recurrent rash, or this child has a headache. So often they know if they put something else at the beginning, we might up triage it, because they're desperate and the parents are desperate. And yeah, we don't have a good solution to how to solve it.
It's really tough, and you know, there are some cohorts that you do prioritise. What are those cohorts, and what are the cohorts that are kind of missing out?
So we have a public system and a private system for paediatric outpatients. So our public, so Medicare funded system, so we prioritise obviously our First Nations Indigenous population and any of our really socially vulnerable families, so pension card holders are all eligible to access the public system. Unfortunately, Wagga has a very large population of socially vulnerable people, so that's why our wait list is still sort of 2 years, even with a select priority population through there. Then the only alternative is to access a private clinic, which comes at a significant cost to families to be able to access that clinic. And there's still a lot of our population that do not fit into the, you know, pension card holders or Indigenous population that cannot afford to access private clinics, but we just don't have another option really. So, you know, if we opened up the public clinics to everybody, our wait lists just would be unimaginable. And there would be a lot of kids who are in desperate need that are just missing out and aging out of the service.
So what happens with those kids? And we might get onto that, because some of them probably end up at Royal Far West, but you know, are parents just giving up and kids' issues just not getting addressed?
Yep, yeah, there are. It's, you know, not uncommon that we see them sort of 2 years down the track and that they have just been sitting waiting with nothing happening in that time. And unless you've got a family that's really, you know, able to advocate and going back to, you know, GP services or through the school to say something's got to change, we need something else, and then there are other avenues to get referred, you know, to Royal Far West or wherever, they just sit and they wait. And this is where we're finding those kids, once they hit school, that the school are advocating for them, going, this is not okay, this child can't speak, this child is severely delayed, and they need to be seen.
Thank you.
I was just going to add to that, when you say what happens to these kids, and this is going to sound really cliched, but this is a part of what we see and what our job is and what our life is, in that the child that doesn't speak very well when they're 2 or 3, that gets missed and then goes to school and still doesn't speak very well and is then bullied, doesn't learn, is the naughty kid, gets in trouble at school, parents say they're naughty, teacher says they're naughty, they believe they're naughty, the behaviour gets worse and worse and worse. It can lead to crime, police involvement. This child probably ends up leaving school early, either ends in jail, unemployed, on a pension, on drugs, maybe at the age of 18 has their own child, and it starts again. And it sounds so cliched, and it is such a story, but this is, you know, real life. for many people, parents or teachers who see this or have their own children, and for us as paediatricians. So it's, yeah, not a cliche at all, or not just a story. It's many, many kids.
So it kind of partly explains this trend that we see that country kids are twice as likely to be developmentally vulnerable because they just don't get the services and never really have.